Doctors are still trying to understand what causes leukemia, but the disease begins when the DNA of a single leukocyte develops a change or mutation that causes it to behave erratically. The cell divides and makes a copy of itself, an action that is repeated over and over. Eventually, these abnormal cells crowd out healthy blood cells and cause leukemia. Leukemia is the second most common form of blood cancer, after lymphoma. In the United States, about 60,650 new cases of leukemia were diagnosed in 2022, and roughly 24,000 people died of the disease, according to the American Cancer Society. Around the world, there are about 475,000 new cases of leukemia diagnosed each year, with over 311,000 deaths. Leukemia can occur at any stage of life. However, some forms are more common in young people, while others occur more frequently in older adults. Overall, leukemia is slightly more common in men, though some forms of this cancer can be more aggressive in women. Doctors have identified a number of risk factors for leukemia. Some are common risk factors for other types of cancer, such as smoking and family history. Treatment for other cancers with chemotherapy or radiation may make you more vulnerable to leukemia too. Other risk factors are less common. For example, chronic exposure to the chemical benzene, such as in the workplace, increases the risk for leukemia and some other blood cancers. People with Down syndrome and certain other rare genetic syndromes also have an increased risk. The same is true of people who develop bone marrow disorders known as myelodysplastic syndromes. There are a few specific steps that can lower the risk for leukemia, such as quitting smoking and avoiding benzene and other industrial chemicals. If you're overweight, shedding some pounds may help. Otherwise, eating a healthy diet and exercising regularly are the best advice.